Do you have lymphedema or are you concerned about getting it? This video is a Q&A with my own lymphatic massage therapist, Susan. We'll hopefully answer some questions that you have about lymphedema. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. In terms of the timing of going to see someone for a lymphatic massage, when would that be appropriate if someone is, having their breast cancer surgery coming up or they've already had it? So I didn't know that this would be something that would be good to do at an earlier stage. I had symptoms already, and so had I known more at the time, I would have come earlier.
After surgery, we can start to work on somebody gently, of course, as early as 2 weeks after surgery.
Okay.
But somebody doesn't need to come in that early. The optimal time, I would say, is 4-6 weeks after surgery.
Yep.
Even the kind, nurturing touch in a calm and soothing, safe place can be really beneficial in reducing the stress and the anxiety of the overall experience.
Yes, because that's present.
Very present.
The whole time, many ups and downs, but it's always there to some extent.
Yes.
Yeah.
I think it is, if possible, it's better to come earlier rather than later, just to get on top of things, to provide reassurance, education, things that somebody can do for themselves. However, if somebody doesn't know to see a lymphedema therapist or they can't find a lymphedema therapist in their area easily, it's not the end of the world if they don't start their treatment until later on. Lymphedema has 4 stages, stage 0, 1, 2, and 3. Stage 0 is known as the latent stage. So as soon as somebody's had lymph nodes removed or radiation, they are in stage 0, meaning they are at risk of developing lymphedema.
Okay.
Stage 1 is when the symptoms first start to appear, and stage 1 symptoms are reversible. So that doesn't mean that we can cure the lymphedema. Somebody will always be at risk of showing symptoms of lymphedema, but it is possible to reverse the symptoms, to reduce the swelling, to return the area to the way it was before the onset of lymphedema.
Okay.
So
like 100% or?
100%.
Okay.
Stages 2 and 3, lymphedema, it's not possible to completely get rid of the symptoms, but it is possible to greatly reduce them and to manage them.
Do you notice a difference with women who've had a sentinel node biopsy versus an axillary node dissection? So a few lymph nodes removed versus more, you can say the numbers.
We sometimes see somebody who's had only 2 lymph nodes removed and no radiation, and they develop lymphedema. And we see somebody who's had 15 lymph nodes removed and radiation, and they don't develop lymphedema. So we're talking about...
That's a big difference, right?
It's a big difference. And so we're talking about increased risk factors, but there isn't a direct correlation. So we can't say you are going to develop lymphedema and it's going to be this stage or this level of severity.
Right. And then how about women who have, let's say, a lumpectomy versus a mastectomy? If you had a lumpectomy, you're more likely, almost always, to have radiation, which is another risk factor.
Yes, the radiation is definitely a risk factor. Not just because it damages the lymphatic system, but because of how it changes the quality of the tissue that is radiated.
Yes.
And so that tight, leathery tissue that isn't soft and supple, that doesn't move well.
I'm very aware of that tissue all around.
That does seem to affect the drainage out of the area.
Yeah. And I was thinking that, if there isn't such a huge difference with lumpectomy and mastectomy, you think a mastectomy is a much more invasive procedure, which it is, and then generally the nodes are taken out through the breast scar, so there is some sort of local trauma in there. But with a lumpectomy, there's a separate incision, which,
It can be.
Not always, but can be. And the addition of radiation is a factor with lumpectomy. So even though the procedure may not be as invasive, there are other factors, that would contribute.
Yeah. I'm really happy that in the 10 or so years that I've been working in this area, I've seen a great reduction in the severity of lymphedema following breast cancer treatment. And I think that's likely due to the ability to identify the sentinel lymph nodes. Fewer lymph nodes are being removed. There's more awareness around the importance of the lymphatic system and trying to minimize damage to the lymphatic system in the treatment for the breast cancer. So most people will come either with stage 0 because they want education, or they have other issues that need to be addressed, complications to the treatment for breast cancer, or they're in early stage 1.
Okay.
I very rarely see advanced or severe lymphedema following breast cancer treatment.
I think I mentioned in another video, I'm probably 90+% better. It's like the odd time I'll still have sort of that upper fullness sort of feeling in the chest, maybe a bit mild here, but for the most part, it's like almost gone.
Yeah.
A number of weeks after my double mastectomy, I started courting. Is that related to lymphedema?
There is an association between courting and lymphedema. Courting is not well understood. We don't know exactly what's happening physiologically when courting presents. We think that it involves the tiny, delicate lymphatic vessels that are affected by scar tissue that result from the surgery and the radiation. And so we don't know for sure that one causes the other. We do often see both courting and lymphedema in the same person.
In terms of the location of where you would see lymphedema, where would you say?
A very common area is the side of the trunk underneath the armpit.
Yeah, definitely had that.
Yes. And I think also it's an area that people notice very quickly because of how our arm swings and brushes against the side of our trunk as we walk and move. Other areas, a lot of women do experience swelling in the breast. And then interestingly, the inside of the arm just above the elbow can be an area where there's a little pocket. But it can depend. Sometimes people will get just a little area of fluid, and it might be somewhere at the base of the thumb or somewhere in the forearm.
So it's not like a general arm sort of swelling. Some people it is, but some it isn't.
Exactly.
Okay.
Exactly. It can be overall. Before there's a measurable increase in size, sometimes people will report a feeling of heaviness or achiness, congestion. Sometimes they might have little tingly feelings. And so I think that that's the tissue holding a lot more fluid than it normally does, but not so much yet that the arm or the area has actually increased in size.
Yeah, I definitely noticed that sort of fullness, heaviness feeling right away. Yeah, before I saw the actual changes. Yeah.
It's important to talk also about tissue changes. So the lymphedema is not just swelling and an increase in size, but sometimes the tissue will start to get a little bit thick, a little bit sludgy. That can get more and more dense, and it can ultimately, in rare cases, end up quite hard. That's known as fibrosis. Sometimes you'll get pitting, and that's when, if you press and hold for a few seconds, when you release, the tissue doesn't immediately rebound. You're left with a little bit of an indent. And so the pitting is associated with the early stages of fibrosis, where the tissue is starting to feel just a little bit thick. The lymphedema fibrosis is a problem because that thickening tissue becomes a barrier to the drainage and prevents the drainage.
It would impede the flow further.
So then you get into this cycle where you have lymphedema, you develop fibrosis, that worsens the lymphedema, that worsens the fibrosis. So the fibrosis needs to be addressed. The good news is it does soften very quickly and very easily. And this is where we change our technique a little bit. We do deeper specific circles or manipulation with the tip of our thumb or the tip of our fingers to try and break up that thickening tissue. And we follow that then with the light, superficial, broad-handed lymphedema techniques to stimulate the lymphatic system to draw that cellular debris out of the area. And that's something that I also teach people to do at home.
Okay, like a deeper first and then
the lymph
I
drainage.
remember we talked about that order. Before my lymphedema symptoms started, I had a ton of tension in my shoulder on that same side. And I think this contributed, right? And so what I'm wondering is, are there women who have lymphedema, whether it's down the arm or chest, sort of trunk area, that don't have shoulder tension?
I think that everybody following treatment for breast cancer has neck and shoulder tension and issues with that part of the body. And it can be from a variety of things. Naturally, unconsciously, we have a protective posture, and so our shoulders can come up and down and curl around the area that has been treated surgically or through radiation, and people might not even be aware of that. That increased muscle tension possibly impedes the flow of drainage of the lymphatic system. the radiation changes the quality of the tissue, the muscles, the skin, and that tightening, leathery quality of the radiation fibrosis, I think, impedes the drainage. The tiny little lymphatic vessels tighten and aren't as well able to contract and pulse to move the fluid through the lymphatic system.
Right.
So I think that all of that is part of the same bundle of experience, and it's all associated.
Right. And I also noticed that I would have, let's say, some tension from, like I said, radiation fibrosis in my shoulder, but even post-surgery, before I even had radiation symptoms, I would have, obviously the chest tension like everyone would have, but I had so much compensation type pain and tension, all surrounding like neck, shoulder, mid-back, and that's got to contribute.
Yes, I'm sure that it does. And I think that when we work with people following treatment for breast cancer, we're not only addressing the lymphedema. I always like to include just a beautiful Swedish neck and shoulder massage to help reduce that muscle tension, to help ease the stress and the anxiety of the situation. But I think that it also contributes to helping the lymphatic system and helping facilitate the drainage.
Right. Yeah, I wanted to talk about that because let's say if I did, our treatments are an hour when I come to see you. And so it's not like you're doing a lymphatic massage for an hour, right? And so you were addressing so many of my other symptoms, so cording, which can be
associated with lymphedema.
Right?
Definitely.
And then all the radiation fibrosis symptoms, so that hardening of all the tissues in the radiated field, shoulder tension, neck tension, and then all the, like I said, compensatory type pain and tension.
Yes.
With many side effects that are stubborn, like lymphedema, I'd put it in that category. Symptoms can go up and down, like mine did. Is this something that's typical?
The fluctuation is very typical, and it can be really frustrating for people, understandably so. So I try and remind them that healing is never linear, that it's going to be 2 steps forward and 1 step back. And there are a number of things that we know can be risk factors, not necessarily, but might contribute to either the onset or a flare-up of lymphedema. For example, heat. So in the summertime, when it's really hot outside and it's really humid, people might notice that their lymphedema is a little bit worse.
Right.
We advise people to avoid saunas and hot tubs. But having said that, those are risk factors. And I do know women who have returned to hot yoga, for example.
Right.
They tried it and it was okay, and so they continued. And that was a decision that they made because the benefits of the hot yoga were very important to them, and they wanted to be able to return to that activity, and they were able to do so without worsening their lymphedema.
And I guess part of the exercise would be helping.
Definitely.
Like the heat may be contributory, but
the exercise would be beneficial.
Right.
So other risk factors for worsening of lymphedema include airplane travel.
Yeah.
Because of the pressure changes inside the cabin. So longer flights can be much harder than shorter flights, and we advise people to wear compression on the plane, to get up and move around, to move their joints, maybe elevate, to do things to help support the lymphatic system.
Yeah, I actually noticed that. I had a flight, it was, I think, even after my reconstruction surgery, not even after my double mastectomy, and I thought I was more in the clear with lymphedema at that point. And yeah, when I got to the destination, only a 3-hour flight, like it really flared.
Yeah.
And so I didn't have any compression specific garments, but I think I wore 2 sports bras on the way home, and then I was doing lots of exercises, moving my arm the whole flight, and it did help.
Exercise, I like to say that exercise is the Goldilocks of lymphedema. So you need to find the type and level of exercise that is just right for you at that time. And that might also change as you condition your body and you get used to doing increased activity levels.
I actually think that exercise for me is one of the most important things that help my lymphedema. Frequent exercise, and especially lifting weights, because your muscles act like a pump, right?
Yes.
Which is, if you're holding weights, it's kind of doing that ongoing.
Yes.
I think that was one of the best things that helped me.
Yes, it's actually known as the muscle pump action.
Yeah.
The opening and closing of the joints and the contraction of the muscles helps move the fluid. And then if you're able to exercise wearing compression, then you've got a double benefit of the joint action and the muscle pump action, but within that inward pressure of the garment.
Right. I was going to actually ask that because I've had a couple of women comment or ask questions about if they have a compression sleeve or some sort of compression garment, should they be wearing it during exercise?
Ideally. Yes. It's going to be an individual thing where some people find that they can exercise and they don't need to wear their compression garments. And in that case, that's wonderful for them. It might change, and then they might have to start wearing their garments for a period of time. But generally, we do advise people exercise in their garments.
Right. How about if someone is wearing a sleeve outside of exercise? So is this a 24/7 type of thing where they would be wearing it all day? Or is it like just during the day? How about at nighttime?
It really depends on the needs of the individual. The compression sleeves and gauntlets, the thin ones, are meant just for daytime use. And there are different compression garments that can be really effective at night. And they're designed quite differently. So you can speak to your fitter about the different types of garments and when they're appropriate. Often at the beginning, when somebody is just learning about how their lymphedema behaves, for lack of a better word, we suggest wearing the compression garments throughout the day. And then people find that they don't need to wear it that much. And so they might only wear it when they're exercising or when they're gardening or when they're shoveling snow or something like that.
Because sometimes, I didn't have lymphedema down my arm, so I didn't need a sleeve. But sometimes people, maybe don't want to wear it all the time because you don't want to look like you're a breast cancer patient all the time. You want to sometimes be anonymous where, people aren't asking you questions or, just looking at you in certain ways, right?
And it might not be really necessary to wear it all the time. And I think what you just described is part of the overall experience. And we do need to be mindful of the overall experience of how wearing a compression garment might make somebody feel, that they don't want to stand out, that they don't want to have to incur questions. There are other ways of managing lymphedema. Often we can use K-tape. And that can be very discreet underneath someone's clothing because it's not bulky, it's flat. They can leave it on for several days. They can apply it themselves. It's inexpensive. There are a lot of advantages to that type of thing. So
I actually did that I'll do another video on this at some point, but I did that when my lymphedema was at its peak, and I actually used it for that return flight home under the 2 sports bras, and it really did help. How about if someone has lymphedema in the sort of trunk area, chest, breast area?
Yeah, there are official lymphedema bras and vests. So one that comes up high under the armpit, that isn't too tight, trapping fluid on the side of the trunk or over the bra. You can also buy pads or foam pieces that you insert into these to provide a little extra spot compression on the side of the trunk or over the breast. You could also look for something like a Spanx camisole that is going to be really tight and snug.
Right.
And that might be sufficient compression.
Yeah, I definitely noticed wearing the sports bra where you get that sort of band of compression and then that puffiness.
Yes, over top.
Yes, above it. I had that all the time. That, if I wore something with a bit more sort of uniform compression, or I did try some of those like specific mastectomy bras, and that's kind of how they're designed, is that it isn't compression just in that band area. It's a bit more spread out.
Yeah.
I've also heard, I think we talked about this before, where the amount of compression or the amount that the fabric goes up can make a difference in the torso area, right? Like let's say if a traditional sports bra would maybe go to here, right? Going up further?
Yes, so if the sports bra stops there, you might find that it pushes the fluid up higher where there is no sports bra coverage, and so then you get a little puffiness between the armpit and the top of the sports bra.
Right.
So that's why you want to look for something that's going to come up fairly high under the armpit and provide, as you said, even compression over a larger surface area of the trunk.
We talked about exercise contributing or not contributing, maybe depending on how much you're doing, but how about, let's say, sort of just everyday type movements if someone was doing things at home or at work?
Well, that's an interesting question because 15 or more years ago, women were given specific instructions. For example, never carry anything heavier than 10 pounds.
Yes.
Be careful with the groceries. Be careful with this.
Yeah.
That's too restrictive and unrealistic for someone's everyday life.
Right.
Now what we advise is to move and monitor. So it's going to be very individual. Try something. If it causes a bit of a flare up, make an adjustment.
Right.
I've noticed that after people have been off for their treatment for many months.
Yeah.
When they return to work,
Yeah.
and then they're sitting at their desk in this position.
If they have a desk job.
If
yeah.
they have a desk job,
Yeah.
then this can be the time when they notice lymphedema or get a bit of a flare-up of the lymphedema. And I think it's because they're spending too much time in one position without breaking up the position and moving around.
Right. And it would probably also contribute, which is what I see every day at work with patients, is there'd be so much more sort of neck, shoulder tension, mid-back, chest, just in holding those positions, almost like a repetitive strain injury in all those areas. And then that could further
And it's a repetitive motion, the typing.
Let's talk about the timeline. If someone's coming in for treatment, what they can expect with their lymphedema.
If somebody has had lymphedema for some time that hasn't been diagnosed or treated, and the lymphedema is somewhat advanced, there's still tremendous benefit in coming in.
Okay.
While the later stages of lymphedema, stages 2 and 3, the symptoms are not reversible, we can still get a great reduction. And prevent the condition from progressing and worsening, which is important as well.
I would want someone at home watching that if you've had lymphedema and it wasn't just a few months ago, if like it could even be years ago, you can still see some improvement. It's just the improvement, like everyone's gonna, improve at their own rate, and it's maybe more likely if they've had it weeks or months that it'll settle sooner than if it were months or years.
Yes.
How would someone go about finding a lymphatic massage therapist? And what sort of credential should they be looking for?
You want to look for somebody who is a CDT. That stands for either combined decongestive therapist or complex decongestive therapist. You hear both terms. And that is somebody who has gone through extensive training in the lymphatic system, the pathologies of the lymphatic system, the treatments for cancer that can contribute to the onset of lymphedema, and the multi-pronged way that we have of managing lymphedema, which consists of the manual lymph drainage, compression bandaging and compression garments, exercise, and skincare. So it is quite an extensive training. Far more than a massage therapist will receive in their education to become a licensed massage therapist.
Like traditional, just massage therapist alone.
And in my training to become a massage therapist, we did have 2 classes in lymph drainage. That accounted for a total of 6 hours. In my training with the Vader School to become a combined decongestive therapist, we had 160 hours of training. So you can see there's a huge difference. So do go to somebody who is a designated CDT.
And I think the value in that is not just, I guess I went to you I had lymphedema, and then I'm thinking I'm going to get a lymphatic massage. I was already getting a bunch of other treatment, but I knew I needed something like that. But I think the value is not just in the lymphatic massage that you're doing when I'm there, but it's all the other things that we were doing as a part of treatment, but sort of guiding you with all the different aspects of what else you can be doing. And I think there's even more value if you're able to find someone who's trained, but that also sees breast cancer patients. Because there is something different and special, I think, about that, because you understand the whole thing.
The big picture.
About breast cancer.
In order to find a therapist, there are a couple of different ways. There are different schools that train people in combined decongestive therapy, and they often have directories. So there's the Vader School, there's the Chickley School, there's the American Academy of Lymphology. In the United States, there's LANA, which stands for Lymphology Academy of North America. In Canada, there's the Canadian Lymphedema Framework, and there are often provincial lymphedema associations as well, and they will have directories of therapists. Also, your treatment center, your hospital, may well have a list of therapists in the community that they provide to patients.
That would actually be a great starting point, I think, if you don't know someone offhand. This was a different format than my usual videos, so let me know in the comments below if you liked it. Also, if there are any questions that we didn't answer that you may have, put them in the comments below, and maybe we'll do a part 2. If you learned something from this video, hit that like button below. And if you're new here, consider subscribing. See you next time.